Assalamualaikum everyone. Am I audible?
Walaikum salam ji.
Welcome to the neurosurgical case room. Let me see. So we start with the anatomy of third ventricle. And if you remember some portion of the lateral ventricle anatomy, then this is going to be easy because some structures are obviously connected. Apart from that, once we are done with the anatomy, the next logical sequence is obviously doing the surgical approaches. So the rest of the 2 sessions for this week will be covering anything that is left from today's session, inshallah, and then the surgical approaches to the lateral ventricle and the third ventricle. So without any further ado, let's begin. For the orientation, I'm going to tell you the boundaries first today in the theory so that you people are not completely lost when we move on to the dissections. So we know that, let me start drawing. We know that the lateral ventricle is, it's a slit-like structure. So in a coronal section or an anterior view, it looks like a slit, but even though it looks like a slit, there are still different structures. There's going to be a wall, a roof here, and a floor. And we know that there will be 2 lateral walls to be an anterior wall and a posterior wall. Now, the structures that make up all these walls are really, really important. Sometimes I feel they're even more important than the lateral ventricle because we do a lot of procedures which are for the lesions of third ventricle. It helps when you know what is around the vicinity. So the lateral walls that you see here, they're actually made by 2 thalami. It looks like a butterfly. I would like you to assume that it looks like this butterfly, and the thalami are making up major chunk of the lateral walls. Apart from the thalamus, obviously the most logical thing to think would be hypothalamus, because under the thalamus, we have the hypothalamus. So there is a safer word that we often use when we are talking about the lateral walls of the third ventricle. It is called diencephalon. So we can say that the lateral walls are formed by 2 diencephalons on each side, and on the view, on the sagittal view, you can even see the sulcus. There's a sulcus. Dr. Vishal, are you trying to say something?
I'm sorry, ma'am. I'll turn off.
Oh, okay. Please turn off your mic. Let me see. There are quite a few other people who are unmuted. Please keep yourself muted. Okay. So this green structure here, this green structure is the demarcation. It's very vague sometimes, but you can see it in the cadaveric dissections on the lateral view, and it separates this thalamic and the hypothalamic region. But the entire thing is called the encephalon. We know that, right? These are the lateral walls, the easiest structure to remember. If you all remember the floor of the, let me draw. Let's see if this is the third ventricle, obviously, there are going to be 2 air-like structures here, which will be lateral ventricle, which are opening into the third ventricle with the help of foramen of Monro, right? We all remember that the thalamus was making up the major portion of the floor and some of the walls of the lateral ventricle as well. But there were 2 other structures here. If you remember the sandwich, we had caudate. After caudate, we had thalamus here. Caudate was making up most of the lateral wall. Thalamus was also contributing to some portion of the lateral wall. And then we had the thalamus on the floor. Around it, we had another structure, which was fornix. And then this is the same, let me see. In the midline, we have the septum pellucidum, and the same sequence is repeated on the other side. This is fornix. Around fornix, we have the thalamus, And then we have the caudate. All of those who have attended or listened to the recording of the lateral ventricle anatomy session, please keep yourself muted. It interrupts the flow of my thought, and it's really difficult to re-continue again. So all those who have attended the previous sessions, they would remember that this is a particular sequence we took time in establishing. Why was that important? Because this thing that you see here, roughly around the floor and some portion of the walls, is what makes up this roof of the third ventricle. So for the roof of the third ventricle, the main structure that you're going to find is obviously these two paired green structures, which are the fornices. And between the fornix and the thalamus, we had something. What was that? Can somebody answer? We studied two different structures.
Caudate,
No.
body of
Caudate is
caudate.
on the lateral side. It
Choroidal
starts with the
fissure.
C.
Choroidal fissure.
That's right. We have the choroidal fissure and the choroid plexus. That goes between the fornix and the thalamus. Just for a quick overview, let me see. We have the caudate here. After caudate, we have the thalamus. After thalamus, we have the fornix. Okay. Between the caudate and the thalamus, we have the thalamus-striate vein. Between the thalamus and the fornix, we have the choroidal plexus and the choroid fissure. So this choroid plexus and choroid fissure and fornix, both of these structures, they make up the roof of the third ventricle, which we see around here. Are you all with me?
Yes.
Yes.
Okay.
Yes, ma'am.
Okay, let me clear all this drawing. So these were the lateral walls. The roof we are going to discuss on the next slide. The anterior wall is a very a thorough structure. Somebody even asked me about the lamina terminalis while we were discussing the lateral ventricles. Anterior wall is formed by lamina terminalis. We have the anterior commissure and some portions of the columns of the fornix. Posterior wall is formed by pineal gland. We have posterior commissure, habenular commissure. In between them, we have some recesses. And we have, let me change the slide. We have two other structures, the roof and the floor. The roof we just discussed. We have the fornix, two fornices in fact. We have telocoroidea and the choroid plexus. Then on the floor, which is probably the most important part in terms of third ventricle anatomy, from anterior to posterior, it is made up by optic chiasm, infundibulum, tuberosonarium, mammillary bodies, and tegmentum of the midbrain. There are some authors which include some portion of lamina terminalis in the floor as well, but that is a disputed structure, so I kept it within the anterior wall. So let's look at some illustrations. They're easier to understand. Let's start easy and then we will build on it. So this is the roof. On top of it, we see the lateral ventricles here. And we know that the floor of the lateral ventricles is going to form the roof of the third ventricle. And we are going to find the telocoroidea. You can also find these columns of the fornices here. Apart from that, some portion of the thalamus. Then we come down on the lateral wall. You can see this, the entire pink thing. This is the thalamus. Let me clear so that I can draw again. This thing here, most of it is thalamus. And then there is this line, the hypothalamic sulcus, which is visible in the cadaveric sections as well. I'm going to show you an image. Below it, we have the hypothalamic structures. What is this thing? This yellow thing?
Interthalamic adhesion.
That's right. This is the interthalamic adhesion. Then, apart from that, lateral walls are very easy, straightforward. Let's take a very good look at the anterior wall. we have the anterior commissure, and then we have the optic chiasm, which is basically included in the floor. But between the anterior commissure and optic chiasm, this is a mass of gray matter. Always remember that lamina terminalis is a thin mass of gray matter. It's a thin layer, and this is also used to access the third ventricle if you're going via a subfrontal approach. So those of you who have assisted, or if somebody has seen any video, I'm not sure, the third ventricular tumors can be accessed subfrontally via the lamina terminalis approach. Clear this. Apart from that, we have the optic chiasm. If you follow the sequence, after the optic chiasm, we have the infundibulum. And with the infundibulum comes the pituitary gland. Then, between the pituitary gland and the mammillary bodies, there is another structure. What is that called? It's not marked here.
Yeah, afternoon, yeah. How are you?
I'm good. Who is this? Did you want to ask anything, or? Okay, I think somebody just wanted to greet us today. Good afternoon to you too as well. So this purple structure, what is this? Can somebody take a guess?
The tubercularium.
That's right. So this is tubercularium. Right behind it, we have the mammillary bodies, and right behind the mammillary bodies, we have the posterior perforated substance around the interpeduncular region. So the floor goes like this. Some portion of midbrain, which is made up by the tegmentum, that also contributes to the floor. Then comes the aqueduct of Sylvius. I'm going to mark it with blue. And after the aqueduct of Sylvius, we have the posterior wall directly. Let's start right from the top. So on the top, we have the habenular commissure here. Then we have a posterior projection, which is called the pineal gland. Then we have the posterior commissure somewhere around here. And this makes up the posterior wall. Anterior wall and the posterior wall, they're easy. Floor is also easy if you remember this lateral sequence. Anterior commissure, lamina terminalis, then we have chiasm, then we have infundibulum, which is basically the pituitary stalk, and then we have the tubercularium, which is marked in other images, not here, mammillary bodies, tegmentum of the midbrain, and then the aqueduct of Sylvius, and then we go posteriorly. Are we all on the same page till this?
Yes, ma'am.
Yes.
Okay, so this is another illustration. It just looks more anatomic. You can see other structures, and let's start marking. You can see the anterior commissure and fornix curving here as well. Just under the anterior commissure, we have the lamina terminalis. And you can see how good of an access this would be if you can make a small opening and then access the third ventricle within. What are the tumors that we can use, that we can access from here? There's a very common one.
Craniopharyngioma.
That's right. So lamina terminalis, translamina terminalis is a very good approach for craniopharyngioma. Apart from that, once we come below, we have the cranial nerve 2, and then we have the infundibular recess. I want you to imagine that we flip this image, because when we are doing the subfrontal approach, how is this going to look like? This is all going to be flipped. So if you are going to find lamina terminalis, where are you going to find it? Below the optic chiasm or above the optic chiasm?
Above the optic chiasm.
Above the optic chiasm. So we are going to try retracting the frontal lobes. Once we have retracted, you can see A2 here, the second segment of anterior cerebral artery, and in between those, you can see this thin, translucent looking structure, which is going to be lamina terminalis. I have some pictures. I'm only elaborating on it because somebody asked this question, I think 2 sessions ago. So we are on the cadaveric image. Because we have done illustrations now, I think cadaveric images would be very easy to understand. You can see the fornix, you can see the anterior commissure, and this is the lamina terminalis, and you see how thin this is. Right under it, we have the chiasmatic recess. Third ventricle has 5 recesses. We are not going to do them today, we will do them tomorrow, but I will just briefly let you know. This is the chiasmatic recess. Recesses are nothing but, these small pockets of third ventricle which extend under the cavities, when there are curvatures or anything. So the pockets that extend into it, they are named as recesses. This is the chiasmatic recess here. You can see the optic chiasm, and you can see the thin translucent membrane of lamina terminalis here. And if I continue, there would be gyri recti over this segment. Apart from that, once we are done with the optic chiasm, we come below and we see the infundibulum. And just posterior to infundibulum, we are going to have the infundibular recess, which is nothing but an outpouching or a pocket of the third ventricle. Then we have tuberosonarium somewhere around here. Tuberosonarium is also nothing but, a layer of gray matter. Lamina terminalis and tuberosonarium both are gray matter. Behind that, we have the mammillary bodies. Posterior to them, we have the posterior perforating substance here. And then we have the tegmentum of the midbrain and this beautiful aqueduct of Sylvius that goes under. Are you all with me?
Yes.
Yes, ma'am.
Okay, Dr. Ganesh is asking what is gyrus rectus. So gyrus rectus is in the basal frontal lobe, and I would strongly advise you to go and watch the frontal lobe anatomy session. We have covered it in thorough detail, along with the surgical procedures in which you do the excision of the gyrus rectus. To be clear, let's move on. Also, you can beautifully see the posterior wall here as well. We have the habenular commissure right around here. And sorry, let me clear. I made a mistake. We have the habenular commissure. We have the, let me see, the posterior commissure. This is the pineal gland, which comes in between both of them. Habenular and posterior commissure, they sandwich in a vertical direction. In between them, there's this posterior outpouching, which is the pineal gland, and this makes up the posterior wall. See? This is a clearer picture, easier to understand. And let me see. Gyrus rectus would be somewhere around here, Dr. Ganesh. Let me start my pointer. So there are no new structures. The only thing that is different in this image is you can see the cortices here. You can see the gyri, the frontal lobe, especially the basal frontal lobe. And we can also imagine how it would look like once, you're doing this subfrontal approach and retracting this entire thing back. Once you retract this around the optic chiasm, you're going to find these anterior cerebral artery segments. In between them, lamina terminalis is going to be visible. Does anybody want to ask any questions?
What is the importance of gyrus rectus, ma'am?
Okay, the gyrus rectus is used in olfaction. It's a part of the olfactory cortex. Apart from that, we take it away when we are doing a ruptured acum aneurysm. I would really, really advise you to go watch the frontal lobe anatomy. I'll leave a link of that session on the group so that, we are not diverted to the frontal lobe. Let's stick to the third ventricle. Does anybody have any questions regarding the third ventricle?
No, ma'am.
Okay, so what do you see here? This is an old image. I have shown this before. What does this show?
Bilateral foramen of Monro and fornix. Third
Sorry?
ventricle in between. Showing third ventricle from posterior to anterior view, ma'am.
But what is going on here?
It's coronal sections of the third ventricle.
Okay. A better idea to
I think,
say, yeah, somebody wanted to say something?
okay, I was saying it's a bird's eye view of the roof of the third ventricle, where it's showing, we can see the fringe of the coronal plexus with the fornix removed, I guess. We
Yes,
can
we
see
have
through,
split
yeah,
the fornix open.
yeah.
Both of the fornices have opened, and yes, you're right. This is the roof of the third ventricle, which has been opened. You can see the choroid plexus around it, and you can see the choroidal fissure. But the fornices have been opened. This is a cadaveric section. You cannot do this in a live specimen, obviously. But since we have opened up, we are still in the lateral ventricle, and we have opened up the floor of the lateral ventricle, which is essentially the roof of the third ventricle. So all you see is a blurred image of the third ventricle, but you can also see the pineal gland because we have completely opened up the space, and you can see the massa intermedia, which goes in between the third ventricle. If I go anteriorly here, if I extend my scope here or a camera inside this recess, I'm going to find the lamina terminalis. Posteriorly, if I extend into this recess, I'm inside, let me see. If I extend into this recess, I'm going to find the aqueduct of Sylvius. Let me clear.
Actually, massa intermedia in the previous image is
Yeah.
quite too anterior, ma'am. It should be in the middle, na, middle of thalamus, na.
No, that's not necessary. And by the way, the view that you're seeing here, this is more of the posterior third ventricle. You cannot see a lot of the structures that are in the anterior third ventricle if you see. We have only opened up till the foramen of Monro. You see, let me go back. The foramen of Monro is intact. A lot of the anterior third ventricle is going to be anterior to this. Let's go back to the sagittal view. So we are somewhere here. We have opened up this space. So what you're seeing is this portion and roughly around this. So you can see massa intermedia is somewhere around here.
Yeah.
If we opened up beyond the interventricular foramen, if we ripped that up open, then we would see the interior structures that we discussed before.
Okay.
So apart from massa intermedia, you can now see on the second image, you can see the pineal gland, pineal recess, and yes, you can see the aqueduct. I was telling you that if I go deeper in this region, if I open it up or I put my scope inside, I'm going to find the aqueduct of Sylvius. This is the exact region. Apart from that, you can see the posterior commissure and the habenular commissure, the pineal gland. Anteriorly, you cannot see much because we have not opened up beyond the foramen of Monro. Okay, in the first image, they have somewhat opened up that space underneath, and you can have a good view of mammillary bodies. And right anterior to mammillary bodies, this portion, the tuber cinerarium, and floor of the third ventricle, this is visible. Are we all on the same page?
Yes, ma'am.
Okay, so this is the zoomed in view of floor mainly, but it also shows the lamina terminalis. You can see, excuse me, you can see the anterior cerebral arteries which are going up. This is going to be the A2 segment. Apart from that, lamina terminalis is visible here. We have the optic chiasm, we have the suprachiasmatic recess, we have the infundibular recess, and the pituitary stalk. The rest of the structures remain the same. Oh, and yes, you can beautifully see the fornix, the columns of the fornix ending into the mammillary bodies. They were not visible in any previous sections. So this is our surgical view because that is our goal as neurosurgeons, to understand the anatomy. We want to have better orientation when we are doing the surgeries. So this is the subfrontal approach. And because the patient is flipped, all the structures that we saw before are not now going to be flipped. Let me go back here. You can see that the pituitary stalk is very obviously under the chiasm, right? And lamina terminalis is on top of the chiasm. So you have to imagine it in the reverse direction when we are doing the subfrontal approach. Inferiormost portion would have the lamina terminalis. In between, you can see the optic chiasm and cranial nerve 2, and then we will be able to see the pituitary stalk. Now you'll see what I'm saying. See, at the bottom of this picture, we have the lamina terminalis right in between the A2 segments of ACA. We can see the ACOM. We have the optic chiasm. Let me see, this is the optic chiasm, and this is the pituitary stalk, which is going. Are we all clear till this?
Yes, ma'am.
Yes.
Okay, let's move on to the next image. This is an MRI image of the same structures. There's nothing new here apart from maybe a beautiful image of A2, which is following the curvature of the frontal lobe here. You can see the optic recess of the third ventricle here, this whitish area, and then you can also see the infundibular recess. It's very small, but it is still visible. Tuber scenarium will be somewhere around this band here. You can see the pineal gland and the aqueduct of Sylvius. So there is no other new structure here. Okay, what is this? What is this illustration?
Floor of the third ventricle, ma'am.
Okay, from the
Showing the-
inside or from the outside?
From the outside. From the outside, we can see optic
Mm-hmm.
chiasm and optic tract.
So this is the
I think
outside
it's the
image.
interior.
That's right. Whoever said the floor of the third ventricle, they are right. But we are looking at the floor of the third ventricle from the outside. This is not the inside view or the view that we get from the endoscope. This is the view that you can have when you're holding a cadaveric brain up. Let me show you some other images. Does it make any sense now? Let me see from inside. Okay, no, this is the outside image. Why is this outside image? Because we cannot see the optic chiasm and the pituitary stalk very clearly from the inside. They are external structures. They are contributing to the wall. So all we see from the endoscope are shadows. What we see when we do the ETV, endoscopic third ventriculostomy, we see these shadows of the chiasm, we see the shadows of the mammillary body, and since this is midbrain, we have the basilar artery running right around this region where my cursor is, somewhere around here. So you're also going to see the shadow of the basilar artery, and the goal is to not, injure it. But this is the external view. Let me go back. In fact, let's stay here. So we have the optic nerves, both of these here. And apart from the optic nerves, you can see the optic chiasm here. These are the optic tracts which are going back. And you can see, let me change my color. This is the third cranial nerve. Apart from the third cranial nerve, you can see the mammillary bodies. Let me mark here. These are the mammillary bodies. This is the interpeduncular fossa. Somewhere around this, we will have the posterior perforated substance as well. Apart from that, this region here is the tuber scenarium, the gray matter which connects the space, or which covers the space between pituitary stalk and the mammillary body. Anterior to pituitary stalk, we know there is optic chiasm. Let's look at the sagittal section again. So it's the same structure. All these same structures, this is in the lateral or the sagittal view. When you flip it and you look at it from the underside, then that is this view. Are we all clear?
Yes, ma'am.
Yes.
Okay, so once we put in our scope through the foramen of Monro for a patient in which we are planning to do the ETV, what you're going to see is these shadows. These are all the structures which were making up the floor, but obviously they're going to be on the outside, and all we see are the shadows. This here is the optic chiasm, and we know after the optic chiasm, there was the infundibulum. Let's go back. Look at the sagittal section. This is the lamina terminalis, the optic chiasm, cranial nerve 2, optic chiasm, and then we have the pituitary stalk, and then we have tuber cinereum here, mammillary bodies. Remember the sequence. Let's come back. And you can see the same sequence, the chiasm, the stalk, tuber cinereum, around this, mammillary bodies. This is the same sequence. You're just looking at it from top via an endoscope. You can see the lamina terminalis, the shadow for the optic chiasm, then the infundibulum and the infundibular recess as well. Between the infundibular recess and the mammillary bodies, there was this gray matter structure which was making up this floor, which is the tuber cinereum, floor of the third ventricle. What is this shadow? This bluish shadow?
Tuber
That's the,
cinereum.
Sorry?
the basilar tip.
That's right. This is
Basilar
basilar
artery.
artery. Tuber cinereum is slightly interior. So the safe space to do ETV is somewhere around here, behind the infundibulum and in front of the mammillary bodies, avoiding this shadow of basilar artery. So this is going to be our work area. We are going to have a separate session on ETV, so don't worry if you don't get it. That's it for today. We are going to cover rest of the third ventricle, especially the recesses, tomorrow, inshallah, and let's see if we can do the surgical approaches tomorrow as well. Do we have any questions? Okay, thank you so much, everyone. This is a wrap for today. Dr. Ganesh, I hope you are on our WhatsApp group. I'm going to leave the link of the frontal lobe anatomy on the group, and you can go watch it so that, there are no confusions. Thank you so much, everyone. That's a wrap for today. Thank you.